Hi everyone, another practice video about where I try to train myself on speaking to the camera. And today I wanted to talk about a connection I've been trying to make between individual health and public health. And as a health and wellness coach, I want to have the ability to influence individual health, of course, but I'm also a student of public health, and the two are connected in so many ways. In public health, we talk about the social determinants of health, which are, your economic stability, which refers to your income, your employment status, your food security, housing stability. Then there's education, your access to quality education, literacy, early childhood development. And there's healthcare access and quality, availability of healthcare services, insurance coverage, and the quality of care. Then there's neighborhood and built environment, which is housing quality, access to healthy food, transportation, safe outdoor spaces. And there's the social and community context, where social support networks, community engagement, the presence of discrimination or absence of discrimination, all of these come into play. So these are crucial for the health of a community, but they also have a direct impact on the health of an individual. And the jury is no longer out on what is best for an individual's health, and that is management of lifestyle. Lifestyle medicine is making so many good points about what's healthy for an individual. And what's healthy for an individual is also healthy for the community and the planet. Lifestyle medicine, all of its emphasis is on the 6 pillars of health, which talk about nutrition, sleep, stress management, avoidance of toxic substances, and social connections. Isn't it interesting how so many of these have like a one-on-one relationship with the social determinants of health that we learn about if we pay any attention to public health? I recently had a chance to talk to an executive at the St. Luke's University Health Network. She's in charge of the community wellness program there, and I was interviewing her for ways in which I, as a health and wellness coach and a public health student, could collaborate with them in terms of bringing health to the local community. And our discussion went to places like moving away from lifestyle medicine, because their community health assessment that they did showed them things like if they're dealing with a population of food insecure or people or the unhoused, then they can't really stress solutions for stress management, because a person who is unhoused there's no way they can avoid stress or, sit down and meditate or sleep well, because they have to sleep with, one eye open is what might happen while they're sleeping. So this is something that our country is not thinking about, among so many other things. For instance, the rolling back of any warnings about PFAS in our water system, about allowing pesticides again for farming, which creates runoffs into the streams and contaminates our drinking water supplies. But I'm digressing. Those are just things that we choose not to think about recently because we want corporations to thrive. And people always think corporations will do the right thing in the end through trickle-down economics. Has that ever happened? Not in my lifetime. So I just wanted to explore some of those connections. And I was thinking about how lifestyle medicine is like the central piece. It's almost like the hub, and it connects to social determinants of health on the population side, as well as what can keep a person healthy on the individual side. And through all this, and the reason why I'm practicing speaking here is because public health communication is just lacking in this country. Not so much in the world, but for sure in this country. There's so much misinformation, so much miscommunication about your health, so many entities that are in it just for profits. Nobody is in it to care for you. It's almost like that famous painting it was called The Landscape of the Fall of Icarus. If you're familiar with that painting, it's a very pastoral, bucolic scene where there's daily activities happening. A fisherman's fishing, a plowman is plowing, there's a shepherd somewhere. Life goes on. And at the bottom right-hand corner of the painting, only if you focus really well can you see these pair of legs sticking out of the water. Someone is drowning and nobody cares. That's life in general. We are all drowning in our own silos and nobody cares. And this has to stop, and this can only happen with communication, with well-researched, well-delivered communication. And it's going to take